Thais Matisse, Whitney Ballins.
We should take this time out to recognize all the fallen nurses that have given their lives in patient care and making sure patients were taken care of.
Nurses, healthcare workers, and community members park their cars at Westfield Shopping in Mission Valley and tune in.
Our beloved colleagues didn't hesitate
For a candlelight vigil to honor fallen nurses for the end of National Nurses Week, a movement by National Nurses United, the local chapter reading names of nurses and healthcare workers that have passed away due to COVID-19. Joyce Johnson has worked at the VA hospital for 25 years.
I've been a nurse for over 44 years. I did my training at this VA back in the early 70s. And I can say that this has been one of the most difficult years in the isolation, not being able to really support each other as we really would, and in the long hours.
Caroline Defoe says every time she puts her uniform on and preps for her day, she knows the risk.
Never seen anything like this before. So it was something totally new, something very heartbreaking, very heart-wrenching.
Delia Tehag, president of the California Nurses Association, has been a nurse for nearly 45 years.
It is difficult, having worked with nurses, friends, families that had been affected and died. It's really difficult for us. And throughout the pandemic, we had been urging for all the hospitals to provide the nurses and the frontline workers with proper PPE.
She says the healthcare system wasn't prepared for a pandemic to keep up with patient flow, equipment for treatment, and safety.
The bottom line is dollars. They want to save money, and they didn't want to provide optimal protection for their healthcare workers. Unfortunately, it's really sad.
This evening is a reflection, a time of remembrance.
It's been very, very difficult, and my heart has gone out to all the nurses that have been at the bedside and working double, triple shifts just to take care of the patients.